Last week, I said we would provide an update on our wastewater monitoring project. This is an exciting project, and I have asked Rebecca Fugitt to join us to talk about this project. She is the Assistant Chief of the Bureau of Environmental Health and Radiation Protection for the Ohio Department of Health. She has worked at the Bureau for 25 years. Rebecca, are you on there? Let's see if I can see you. Okay.
Yes, I am. Yes, I am, sir. Thank you.
Thank you for joining us. We appreciate it. Tell everyone why we are monitoring wastewater and how that is working.
Okay, so the Ohio Coronavirus Wastewater Monitoring Network tests wastewater for gene fragments of COVID-19. Because people start to shed the virus early when infected, a significant sustained increase in these gene fragments found in wastewater can be an early warning sign of a pending increase in a specific area's COVID-19 cases and could point to possible hotspots or potential community spread. Having this information gives communities an opportunity to act proactively to prevent outbreaks.
And you talk about early. Any idea how early this might be compared to when people you start seeing people with symptoms? Any way?
Yes.
Yeah, go ahead.
Research suggests and our data indicates that we start to see increase in cases anywhere from 4 to 7 days prior to, and we start to see the increases in the wastewater 3 to 7 days before increases in cases.
And how many cities are we looking at that now?
We've seen increases in about 6 cities over the last several weeks, and most recently in 3 cities across the state.
And how many total cities are being monitored now? Do you know?
We're currently monitoring 36 cities, and we plan on increasing an additional 25 cities within the next month.
You and I talked earlier today, and you told me that this is kind of a work in progress, and that you're not only are you warning cities or communities when you see something, but we're trying to learn some things as well. Can you talk a little bit about what we know, maybe what we don't know yet, and what we're trying to learn?
Well, what we're trying to do is we're monitoring the viral gene copies that we're seeing in the wastewater, and we're just starting to begin to compare that to case data within communities so that we can confirm that we do in fact see this viral gene data as a leading indicator of disease. So we're closely monitoring the results that we're seeing across our state. We are monitoring a number of sites biweekly now. We'll be moving to monitoring all of our sites biweekly so that we are able to provide that 3 to 7 day leading indicator of disease. And then when we see this information, when we see increases, we alert health officials and utilities of any sustained upticks in their communities. And we've provided a toolkit that helps inform the public, and we're coordinating to help offer pop-up testing and contact tracing support for those communities. Just most recently, we've worked with several local health districts to do this.
And what districts have you worked with? I think you told me Mansfield, Akron.
Yes.
As well as Lucas County as well. You want to just tell us a little bit about that?
Sure. The Toledo-Lucas County Health Department has a pop-up testing event planned and has notified the community through a press release about the increases in their wastewater data. We've most recently worked with the Richland County Health District. They've issued a press release today regarding increases observed in Mansfield following the Labor Day weekend. The increase in gene fragments in the wastewater was observed about 5 to 7 days before we saw increases in the community. So when the virus does increase in the community, it can quickly spread to impact other businesses and facilities within the community. And then in Summit County, officials are comparing our findings with COVID-19 case data for the areas served by the plan in Akron, so they can better identify some of their hotspots and areas of concern.
So I don't pretend to be a wastewater expert. When you do this, let's say you're doing like Lucas County, is there one place that all goes to, or is there ways to actually see where that's coming from?
Currently in a monitoring network, we're measuring the gene copies in the raw wastewater that's entering the wastewater treatment plant. So right now, the data that we collect reflects the community that's served by the wastewater treatment plant. We do have the ability, we do have the ability to go into communities and monitor in specific sub-sewer sheds within that community. We just haven't started doing that yet within the network, but that is a possibility, and it's been done elsewhere across the country.
And I think you told me for Lucas County, it was actually Oregon. Is that right? It was not actually the city of Toledo. Is that correct?
That's correct. It was in the suburb of Oregon.
Okay, very good. As we move forward, are you going to expand the number of sites?
Yes, we currently have 36 sites that we're monitoring at, and we'll be adding an additional 25 sites in the coming month.
Okay. All right. We look forward to hearing more and learning more. Thank you very much. We appreciate it, you being on.
Thank you for having me.